I'm going to talk about cardiac glycosides. So the prototype of this is digoxin. It should be noted that this is a positive inotrope. Which means it's related to or influencing the force of myocardial contractility. So the pharmacokinetics it is both oral and IV. Or, I'm sorry, not IV. Parenteral. Meaning IV, IM. Learning more about digoxin. Okay, so oral tablet, elixir, capsules, and then parenteral, IV, and IM. And so, should be noted that the elixir, can't see that very well. The elixir is absorbed most effectively there are no other drugs of this class, and action it increases contractility of the heart muscle, which allows it to pump more effectively. Use mild to moderate heart failure. In older adults, should not be used as first line therapy. Increased risk of toxicity due to the older you get, the decreased liver kidney function to break that medication down. In patients with renal impairment, use with caution. It delays drug excretion. Excretion, increased risk of toxicity. In patients with hepatic impairment, has no effect. So no caution needed. Adverse effects. Toxicity, increased risk of digoxin. Just digoxin toxicity. Green halos or vision disturbances. Premature ventricular contractions or PVCs. Contraindications. Severe myocarditis, second or third degree heart block, ventricular tachycardia, and ventricular fibrillation or VFib. Nursing implications. Dose should be decreased by 50% with concurrent administration of amiodarone. Drugs that increase the effects of digoxin are epinephrine, antithyroid agents, and calcium preparations. Drugs that decrease the effect: antacids and acarbose. And then herbs that increase the effects: ginseng, hawthorn, licorice, milkweeds, And then herbs and foods that decrease the effects of digoxin, psyllium, and St. John's wort. Medication administration. Thoroughly assess cardiac status. Hold if heart rate is less than 60 beats per minute. Assess for digoxin toxicity. Assessing for therapeutic effects. Improved strength of myocardial contraction. Assess for edema, and then monitor for ditch toxicity. PVCs, things like that. Teaching. Why it's given. Take as prescribed. Take with food. Signs and symptoms of ditch toxicity. Tabs can be crushed. Limit sodium intake. All right, I think that's all. Thanks for following along.